Okay. All right. Well, welcome. Welcome everybody. Thanks for taking time to join the webinar tonight. This is the first actually of many that we're going to begin to do, and my hope is that we can start to engage more and hopefully educating and empowering you. And my intent is always to try to get people to think outside the box a little bit when when we start looking at health challenges and issues that people may have. So tonight, what we're going to do is I'm going to run through a presentation I actually put together quite a while ago on detoxification and why it's so vitally important to detoxify the body periodically. So before I get into that, I need to obviously share this health information disclaimer with you. We unfortunately live in a world that is extremely litigious these days, and so we have to do things like this. I know you're all well aware, but I've got to read this anyway, so I'm going to. The information provided in this presentation is not intended to replace the advice of a doctor or healthcare provider. It's rather intended to help you make better healthcare decisions and take greater responsibility for your own health. You should not use this information to diagnose or develop a treatment plan for a health problem or disease without consulting a qualified healthcare provider. By watching or participating in this presentation for informational purposes, you expressly acknowledge and agree that Unified Health Group, Inc., Nutrimos Denver, Nutrimos Doctors LLC, its trustees, officers, employers, agents, and/or assigns are not responsible for the results of your decisions regarding use of this information, including but not limited to your choosing to seek or not to seek professional medical care, or your choosing or not choosing specific treatment based on this information. So, anyway, that's always fun, but it's part of the deal. So, okay, I will. Promise you that I'll move as quickly as I possibly can through this information. It is a lot of information, and I actually have pulled some things out of this presentation. This was originally put together to do in a workshop format. So like I said, there's going to be a question and answer session at the end of the presentation so that you can you can ask any questions. I will stay on as long as I need to answer any questions that you may have. But like I said, my hope is that by the end of this, you have a different frame of thought in terms of your body and how it works and what may potentially interfere with its ability to work. So, all right, so here we go. So how toxins may be affecting your body's ability to properly function, decreasing your energy, ability to lose or maintain ideal weight, get good sleep, cause unwanted health symptoms, and much, much more. That's what we're going to work on through this. So, I've met some of you and I haven't met some of you, so I thought, what the heck, I'll give you a little background on me. I graduated my undergraduate from the University of Iowa. I went to Palmer College of Chiropractic, graduated from there. I got licensed in the state of Colorado in 2002, so I've been in clinical practice since 2002. I am involved in I've done a lot of postgraduate stuff, but currently there's a postgraduate program that I've begun. I'm about a year into it. It's a 300-hour program. You kind of do it when you have the chance, but it's a diplomate in the American Board of Chiropractic Internists. So a lot of functional blood work and really looking at the body from a functional perspective as opposed to just a pathological standpoint. So that's more of an interest to me than anything else. But anyway, we'll talk more about that later. Seminar speaker. I've done a lot of speaking throughout the country at various seminars to large groups of doctors and rooms and people and all that sort of stuff. So I enjoy the educational aspect of this. I've consulted a lot of doctors across the country because of those seminar speaking events and so on and so forth. Primarily, a lot of what I've done with doctors in the past and that I've helped is to really understand how to integrate nutrition into their practices, or how to begin to utilize nutrition to help their clients or patients. And we'll talk more about that because I'm going to try and create a new foundation for you in terms of how you think about health. I'm an absolute sports and fitness fanatic. I played baseball. It's interesting how I got to this point as a baseball player. I'm not going to spend a lot of time on that. But it's funny how I look back over my life and I'm exactly where I need to be. I thought that I was going to be one of those people that would be playing professional baseball, and was told that, and injuries and all that sort of stuff led me to chiropractic and where I'm at right now in terms of this healthcare world, if you will. And last but not least, I'm a husband and an extremely, extremely proud daddy of two beautiful little girls. I've got two amazing little girls. These pictures here are older pictures. Believe it or not, they're now 10 and 7. I can't hardly believe it. It's crazy how fast it goes. seems like I just put these pictures on these slides yesterday. So so crazy how fast time blows by. But they're the reason I do what I do, and they're the most important thing in my life. So I'm sure that those of you that have kids can relate to that. You know, we do what we do to make our children's lives as good as we possibly can. So, all right, so what are we going to do? My hope is that you're going to discover how toxins in your body could be stealing your health and vitality, that the major contributors to your body's what the major contributors are to your body's toxic overload are, how toxins are decreasing function of key bodily organs and setting you up for possibility of disease or health issues, and how to clean up your body and regain the energy that you want or that you once had, and hopefully a lot more. So today, you know, and over my many years in practice here, you know, typically people come and they've got these various things. You know, they've got fatigue, they've got just general malaise, they feel weak, they get headaches, what they call normal headaches. I've never seen a normal headache, by the way. There's a difference between normal and common, by the way. I'll tell people is that, yes, headaches are common, but they're not normal. So we'll talk about that. Depression and anxiety, chronic back pain or back aches, weight gain, muscle aches and pains, IBS, PMS issues or menopause symptoms, anxiety, insomnia. Looks like I have insomnia twice, and a whole bunch of other stuff. And frequently, because of the world that I live in, a lot of these people come after they've already attempted traditional drug therapies. You know, they've attempted utilizing traditional drug therapies, and it hasn't helped them get where they want to get. It provided a certain amount of relief for a period of time, or it didn't provide any relief at all. But there's a reason for that, and we'll certainly discuss that. Come on, okay. So why detoxify? If you read the email that we sent you last week, you probably saw this statement. It's estimated that there are over 80,000 chemicals that pollute our air, food, personal care, and home cleaning products right now. And because of this, the estimates are that the average person, people like you and I, have more than 700 known toxins lodged in our body's organ systems. So when you think about toxicity and the challenges that toxicity create, let me bring up my little pen here. There's this thing I call the biological continuum, okay? So I want you to think about this from the standpoint of, God willing, we all come into this world 100% healthy and well, right? And how many of us were brought up, I know how, you know, the world that I was brought up in is the same world that many of you were brought up in, and that is that most of us were taught really not to think too much about our health unless we developed some sort of symptom or some sort of challenge or whatever it is. So, you know, we come into this world healthy, and we're taught to not really worry too much about our health until something kicks in. So there's a time component involved in that typically, okay? Now, as time passes in our life, we're exposed to a bunch of different things, a bunch of different stressors, and those stressors could be stressors that affect us physically, they could affect us organically, and they can affect us emotionally. More to come on that. And as those stressors build, eventually what begins to happen is your body will manifest these things that I refer to as dis-ease. So this word dis-ease, and if you think about dis-ease is really symptoms, okay? And when we get symptoms, or when we've gotten symptoms, we've been taught that we need to manage those symptoms. And typically how we manage them is through drug therapies or outside-in thinking. And when you're in that world of just managing dis-ease through outside-in type, synthetic drug chemicals or surgeries or, even chiropractic or massage or whatever it is, a lot of times you're not getting to the root issue, which means that the cause of that dis-ease progresses, and it can ultimately progress to a point of disease. And when you hit a disease state, what's the typical approach? Well, it's typically more drugs, more surgeries, more outside-in sort of thinking. And what this is doing is it's really allowing a person's body to move in this direction towards no health. And obviously, when we hit this point of 0% health, that's when we check out. That's the point in time when we, when we move on. We make that transition, whatever you want to call it. Well, this is a lot of times when I see people, or when people will come in, they're having some sort of symptom challenge, and they're tired of being just drugged or symptomatically managed. So what we want people to understand is, listen, there's nothing wrong with doing things to try and manage symptoms. The problem is that if you never get to the cause of it, then you're going to keep moving down the continuum to this place here, which is where many of us want to avoid going for a long, long time, I suspect. And I suspect you're on this call because you want to avoid that. So what we want to try to teach you is that if we can figure out what the interferences are that are ultimately creating the symptom challenge that you're having, and this is what I refer to as a functional approach, then we can start to help you move back in this direction, okay, towards being healthy, a better state of function. And that's ultimately why detoxification is so important. So we'll get to that here more in just a second, okay? Hold on here 1 second. I'm going to erase everything. So, whoops, here. All right. So this is something that I've used to try and explain to people it's called the functional model versus the symptom chasing model, okay? So once again, when you think about health, think about it from a functional standpoint, okay? In other words, how is the body working? Now, for us to have good function, we've got to have good function structurally, we've got to have good function organically, and then, of course, we want to be emotionally functional. You know, what are the thoughts that we're having on a daily basis, and how are those thoughts potentially affecting function, okay? Now, I'll give you an example. Someone comes in and they've got back pain. That back pain is, of course, a structural issue, which is contributing a decrease in function here, which can ultimately create symptoms or issues, or the reason why the person is seeking help. Now, this person has back pain, but they also have diabetes. And this diabetic individual, because of their diabetes, we know has organic issues as well. So we know that there's a decrease organically for this individual also, okay? Now that organic dysfunction, which is no doubt playing a role in terms of the structural dysfunction, starts to create a combination of issues for these people many times that leads to a decrease in quality of life, okay? Or stressors where they can't have a good relationship with their spouse, with their kids. They can't travel. They can't do the things that they love to do in life. And this ultimately begins to lead to a cataclysmic event of emotional distress and emotional frustration and potentially depression and all the like that goes along with a low quality of life. And so when you start to think about the body from a functional standpoint, you think of these three macro categories and them all working extremely well, then you begin to realize that when people are having a health challenge, they've got a functional loss of some sort. That functional loss is leading to dysfunction here, which ultimately manifests in, once again, these things we call symptoms, okay? The traditional thinking is when you have symptoms, whether it's fatigue, weight gain, blood sugar dysregulation, high blood pressure, fat storage, joint pain, brain fog, digestive issues, whatever you can think of, most people are given the choice of managing the sickness and symptoms with drug therapies, okay? Once again, I'm not anti-drug and I'm not against that because it's no fun to have these symptoms. The problem is that that's where most things stop for people. And they get these drugs to treat these symptoms, and those drugs may cover up those symptoms for a little while. In other words, the person doesn't have the headache or something like that, or the blood pressure goes down a little bit. But as soon as they go off the drug or whatever, the high blood pressure goes back up, the headaches come back, whatever it is, so they get back on the drug to manage the symptom. And before you know it, they're stuck in this symptom-chasing model here, and they don't know how to get out, and they're just getting on more and more and more drugs to try and manage the more and more symptoms that are created by more and more dysfunction. So think about it this way. If we, and I'm going to simplify this, obviously, just for the sake of time, but if we think about this from the standpoint of, if we think about this from the standpoint of function once again, and we get to the cause of the structural issue, the organic issue, and ultimately what's perpetuating or potentially contributing to the emotional issue, and we flip all those arrows so we increase function there, well, of course, function's going to go up here, and as whole body function increases, typically what happens is the symptoms go away, which means the need for the drug therapies begins to go away. And that's the thing that we begin to see with so many people, not because we're telling them to stop drugs, not because we're treating a medical condition. It's because we're going and looking at it from a more functional standpoint and working on supporting the body in a way that helps it to work better, okay? So this is where I say your choice becomes not one thing, okay? You can certainly utilize the drug therapies to try and help manage your symptoms, but I believe that ultimately you want to go after doing something that begins to work on addressing the cause so that the problem gets solved. And then eventually you won't need the drug. So hopefully that makes sense. Okay, and we can revisit that with questions if you want at the end of the presentation here. So let's move on here. Okay, so great health is really a matter of choice, and that's what I want you ultimately to walk away with, is you don't have to feel like you're a victim to the system anymore. I'm telling you, when we're done with this, you're going to realize that there are things that you can do to make your life and your health as great as you want it to be, okay? And hopefully we can empower you, and you know, if we deserve it, and if we're if we do our job, then we would love to participate in helping you get there, obviously. So, you know, reaching this place of optimal wellness is really vitally important, okay? So when we look at systemic interrelationships, that's kind of what I was talking about, where it can start with conflict in consciousness, you know, where it creates disturbances in the physiological function. Now, that functional disturbance can lead to cellular damage, and that cell damage will lead to dysfunction of organ systems, okay? So improvement of cellular functioning and correcting metabolic imbalances and supporting structural integrity can ultimately begin to normalize organ function and promote the restoration of health. And so we talk about, you know, number one, most people want relief of pain that they're in, and that's quite understandable. So we want to get relief of that pain, but we ultimately want to help you to understand that the next step is you got to begin to restore health, you know, begin to restore function. And as that begins to happen, you start to experience some things that maybe haven't experienced a while in terms of, you know, alleviation of symptoms, improved energy, better sleep, all this stuff. And all of a sudden you become more empowered because you know it's possible, okay? And then that leads to inspiration and the like, and it's really neat to watch. So the core concept here is that the core of every illness is really total toxin exposure. You know, so the body becomes overwhelmed and the body's homeostatic mechanisms become interrupted, all right? And these can be exogenous or endogenous toxins that can act suddenly, or they can act insidiously over months or even years. For example, the process of heart disease, which we'll talk about, is exactly that. It's a process. It's not, no one goes to bed with a healthy heart and wakes up the next morning with a diseased heart and falls over dead of a heart attack. That process happens over time, okay? And usually there are absolutely no symptoms associated with heart disease. The first symptom is usually death from a heart attack. That's when most people find out they've got a diseased heart, okay? So we want people to begin to think about these things differently. So this is pretty interesting. This is back from 1910. This comes from a lady who discovered the phagocyte, which we won't go into. But anyway, this statement's powerful. The natural death of human beings cannot be regarded as due to exhaustion from reproduction. It's more likely due to an auto-intoxication of the organism. The inherited structure of the human large intestine and the customary diet of civilized man are especially favorable to the multiplication of toxic microbes that cause intoxication, okay? So we're going to talk about the digestive tract today. So when you think about total toxin exposure, it comes from multiple areas. Once again, we talk about the physical component, injury, inflammation, eccentric exercise, emotional stressors that ultimately create physical disturbances, okay? Nutritional issues, preservatives, sugar, artificial sweeteners, additives, colorings, alcohol, trans fatty acids, otherwise known as partially hydrogenated fats, infection and chronic infection, and the endotoxins and exotoxins that are created from those bacteria, viral infections, fungal, parasitic issues, and then, of course, chemically related issues associated with xenobiotics and various organics, okay? So this is a really interesting story. This guy worked in a hospital, believe it or not. He was a retired military guy, and he was working in a hospital. And William, his wife and daughter were patients of mine, and they were trying to get him in to see me because he had fallen into a really bad place. Polyradicular neuropathy started to develop, okay? So as it says right here, it started with a subtle tingling in my toes and fingers like they were asleep. Through January and February, my entire body went numb, and I had no sense of touch or feeling. Concurrently, there was an overwhelming loss of strength and energy and a loss of equilibrium. I always had to hold on to something for support, would still fall 10 to 15 times a day. I had to give up my job. I could no longer drive a car, could not button my shirt or tie my shoes, nor could I pick up a pen and write my name. I had been seen by a number of neurologists and doctors at the VA and at University Hospital. Dr. Cadwell, blah, 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 blah. Well, what happened was, so this is this is why I want you to understand the depth of this and how important detoxification is, and doing it regularly so that you're not waiting for something like this to happen. Because for about 2 months, this progression happened over about a 2-month period, and they put him on a lot of heavy-duty drugs to try to manage his symptoms, and they couldn't figure out what was going on. So he and I sat down and had a long conversation, and basically what I found out was that the symptoms started about a week after he got a flu shot. Now, if you're in the military, you're a pincushion, okay? In other words, you've been stuck by so many vaccinations that it's ridiculous. And there's so many chemicals in these vaccinations and just bad things overall that contribute to toxic overload, which we'll get to. But this was the proverbial straw that broke the camel's back, in my opinion, based on our conversation. So he got the flu shot, and within a week started to develop all of these symptoms. We had to do we did some long talking to get to that finally, but that's when it kicked in, because you're going to have thimerosal in flu shots, which is mercury, which is extremely neurotoxic, by the way. And so we did a heavy metal detoxification on him, and within a month he was back to 100% normal. This is a guy who's basically, quality of life disappeared quite literally overnight. And, and what we did with him detox-wise restored some things really, really quickly in the big scheme of things. So it was a really cool story. So when you start thinking about all these toxins, carcinogens, which are cancer-causing agents with the largest air, water, land releases, dichloromethane, styrene, chloroform, formaldehyde, tetrachloroethylene, benzene, acetaldehyde, lead, 1,3-butane, nickel compounds, yada yada. This is in pounds that's released, you guys. So the point of this is that there's a lot of carcinogens that are going into our environment, and we're being exposed to those. And oftentimes it's unknowing. You don't necessarily know this. The chemicals that are frequently found in water, which is why we tell you to drink purified or filtered water. These are common chemicals. And this one at the bottom here, pharmaceutical drugs, they're seeing a lot more pharmaceutical drugs in tap water now too, by the way, because people are flushing their unused drugs. So you're seeing a lot of, believe it or not, birth control pills are a biggie. You're seeing a lot of that. You're seeing a lot of anti-anxiety and antidepressant drugs as well. So that's why we want you to drink filtered water. So some of this you can see. So, we here, if you live in the Denver area, if you've ever driven down from the mountains, you see that brown cloud that's sitting over the city, right? And then over off of, I think it's 270 or whatever it is, the 270 connector between, or whatever, you've got the fracking stuff going on, or the refineries, not fracking, but the refineries and the smoke going into the air. You see, these are things that, once again, we can see, we can see water pollution sometimes. So some of the air pollutants, these are typical air pollutants here. Some of them we can't see. So the invisible CFCs from aerosol sprays that affects our ozone layer, invisible fumes from chemicals that are used in your personal care products, paints, cleaners, solvents, fuels. These also can contribute to health problems for us. Your home. I had another woman who was really, really sick and ill and having all sorts of issues. And long story short is we eventually found out that she had moved in to the house, and basically there were spiders or whatever. So she was having her house, she was having pesticide people come in and basically spray her house every week with chemicals. And she was getting her hair colored basically every week as well. But her home was a gigantic source of her sickness. So you always want to think about the things in your home and how those things are potentially, creating toxic issues for you, okay? Some things we choose, some of these toxins, cigarette smoking, excessive alcohol use, poor diet or poor food choices, once again, personal care products, water, all of these things can begin to add weight to the toxic burden that our bodies are carrying. So, but the great thing is that these are lifestyle choices that you and I can make for ourselves. And so we can exercise control over these potential toxic exposures, right? You can't go over and shut down those refineries over off of 270. That's kind of part of it. You can't unfortunately do anything about the solvents and the fuels and the gasoline and all that stuff. So, but you can do a lot to address not only that, but the other things that you can avoid. Darla, this is just another one. This is a woman who basically almost overnight, same thing, just things, the dominoes fell over for her. FDA prepares warning on tuna. This is where we talk about, being conscious of where your food is coming from. There are certainly safe places to get seafood from, and there are places that you want to avoid getting seafood from. Organic, we talk about eating organic, but also you want to find out where the organic is coming from. Some of these grocery stores that are selling organic food, and using, certain labels, they're growing their organic food next to the conventionally grown food. So there's a carryover of the conventionally grown herbicides and pesticides and things like that, and they can dribble onto the organic foods. Okay, so once again, things to think about. So when you go, try to ask questions. Are these grown next to conventional fruits and vegetables? Go to your farmers market. That's the other great thing about being in this part of the world. We have access to great farmers markets here in the metro area, which is phenomenal. So all of this creates this sort of deadly soup, if you will, that we have to breathe in or be exposed to on a daily basis. The biggie, I showed you my kids at the beginning. This is the one thing that I won't get into all the details of it, but but my children, and I don't mean to make this talk about anything other than detoxification, but my children have never had a vaccination, and that might make all of you go, whoa, what is he thinking? And I understand, based on the information that you've been provided, you might think that, but I can guarantee you that choice wasn't made without my due diligence. And long story short is, both of my daughters are extremely healthy. They've never been on a drug. They've never taken an antibiotic. Like a lot of kids these days. So so the point is that for me, I want to keep my kids as clean as possible, and I want to do things to promote an improvement in their body function, an improvement in their immune function, and not put chemicals into their body that dampens the immune system and potentially creates other problems. So when we look at the health of our children, we have to begin to understand that things are happening right now to kids at alarming rates that cannot be explained genetically. Okay, toxic playgrounds. There was a time where arsenic-treated wood was common. On playgrounds especially. And I believe it was 2004 when they stopped that. But if you have children who are at schools that have, most of them don't, but then you got to worry about the plastics and all that sort of stuff. But the point is, these are things that a lot of people don't think about. Okay, we've been drowning in a pool of chemicals. So this little statement from from the year 1989, even back in '89, they said the chemicals pumped into our environment in the U.S. in 1 year alone would have filled a line of semi-trucks stretching from Los Angeles, California to Des Moines, Iowa. That's a long ways. So how does our toxic environment affect our health? So what's the impact of the external environment on our internal environment? Sometimes it can be high. So these substances can cause changes in the way our bodies work. Pollutants and their effects have been linked to various health problems, ranging from increased respiratory problems, like simple asthma, to increased risk of a variety of cancers. And there's a lot of kids being diagnosed with asthma these days, okay? And, of course, the cancers. So chemicals, cancer, and you. A side note is we are going to be doing another deal like this where we're gonna share this documentary with you, so you can watch it from the comfort of your own home. And my feeling is the last one, maybe we can get together and watch together, whatever we'll do, but it's called The Truth About Cancer. Unbelievable documentary, very empowering, lots of great information. But I want to share that with you. And so just FYI, look for that eventually. We'll be doing that. But chemicals, cancer, and you, it's vitally important that you understand the role that a lot of these chemicals that are floating around out in the environment, the ones that we're consuming from our foods and so on and so forth, are contributors, okay, to this unfortunate thing. So how does our body rid itself of toxins? Well, the good news is that you and I live in a body that was naturally designed by nature to cleanse itself. So our bodies are designed to get rid of harmful toxins and agents and protect against the damage that can be created by them. So our detoxification systems are wonderfully and amazingly adaptable and capable of handling a great many toxins, okay? The bad news is our systems can become overwhelmed by overexposure to the toxins found in the air, the water supplies, the personal care products, the cookware, the drugs, and the chemicals and hormones, in addition to the endocrine disrupting chemicals, by the way, that are added to our food. And there's a book I've recommended to a lot of you. I talk about it on the radio show. It's called Salt, Sugar, Fat. I strongly recommend you buy that book. It's incredibly insightful, for sure. But the symptoms of fatigue and frequent headaches, lack of mental clarity, weight gain, anxiety, digestive distress, all that stuff that many people feel is oftentimes a result of just toxic overwhelm. So there's exotoxins from pesticides, industrial compounds, and chemical byproducts, combustion, things like that we already talked about. Xenobiotic exposures, since World War II, and this is probably about 5 or 6 years old, by the way, so there could be more. But since World War II, between 75,000 to 80,000 new synthetic chemicals have been released into the environment. Less than half have been tested for potential toxicity to adult humans. Over 4 billion pounds of pesticides are used annually in the United States. This amounts to 8 pounds for every man, woman, and child. Current law allows 350 different pesticides to be used on the food that we eat. And the average home contains 3 to 10 gallons of hazardous materials. And then the statement here, which I said earlier, the average American has 700 plus toxins lodged in the tissues of his or her body. So common xenobiotic compounds found in the adipose tissue of Americans. And that's the thing, is the adipose tissue is where, that's the fat cells, is on some level a protective mechanism of the body. That's why we talk about detoxification as a part of the overall weight loss picture too, by the way, is because when the body has a lot of toxins in it, it's not going to want to let go of the excess adipose because it's somewhat of a protective mechanism for you, okay? So we talk about clearing and cleansing that so the body can ultimately let go of that adipose tissue, okay? And then, of course, the interferences and imbalances that those things create as well, which we can talk about later. So in terms of pesticides, of the roughly 900 pesticides active ingredients registered in the U.S., more than 160 have been classified as known or suspected carcinogens by the United States Environmental Protection Agency, okay? Pesticide content of common foods. So here's the 12 most contaminated. Here's the 12 least contaminated. I got this from organic.org. So 12 most contaminated, meaning you definitely want to buy them organically: peaches, apples, sweet bell peppers, celery, nectarines, strawberries, cherries, pears, grapes, spinach, lettuce, potatoes. 12 least contaminated. I still suggest everybody buy organic, and of course ask questions like I said earlier, but onions, avocado, sweet corn, pineapples, mango, asparagus, sweet peas, kiwi fruit, bananas, cabbage, broccoli, papaya. Strawberries, just to give you an idea, okay? So in terms of growing strawberries conventionally, here's how it works. Soil is covered with plastic sheets and repeatedly saturated with methyl bromide, which is a very toxic pesticide, by the way, which kills all weeds, insects, and soil microbes. In 1999, over 5 million pounds of methyl bromide were applied to strawberry fields in California. Methyl bromide is a Category 1 acute toxin. Side effects include headaches, myalgias, blurred vision, nausea, disequilibrium, damage to lungs, kidneys, reproductive organs, and the central nervous system, can lead to fatality. Strawberry pickers with these symptoms are often told they have the flu. They happen to get the flu every June and July. So the UN panel estimated that methyl bromide use has caused a 5 to 10% depletion in the ozone layer. So there's another issue. Joyce is interesting because Joyce got run over by a truck, basically. She was, one of those individuals who had a major trauma that happened. And because of that major trauma, started to develop chronic pain. And, of course, ultimately was diagnosed with something called fibromyalgia, which oftentimes is, it's a junk diagnosis given to people with a multitude of symptoms. Doesn't mean that their symptoms aren't real. They're real. They just don't know what to do with them typically in the conventional approach, so they usually just give them drugs to try to manage their symptoms, and that's basically what happened with her. This woman, though, extremely inspiring. I mean, she took total control. I mean, all of these people did. I can't do the work for them. Our team can't do the work for them. They did the work, and the results they got were great. So chickens on drugs. So when we start talking about food, once again, this is why we talk about eating clean food, organic food. We talk about free-range chickens. We talk about eating beef that's not injected with hormones or a ton of different antibiotics and all that sort of stuff, okay? And this is important because antibiotics are in our food chain. Americans consume about 3 million pounds of antibiotics every year, from animals, basically. Chicken and cattle consume more than 24 million pounds. The problem, dosing livestock with antibiotics can breed bacteria resistance to drugs. And once again, this is a major issue. It's been a major issue for a long time, creating superbugs. So the antibiotics in our food ultimately destroy the good bacteria in our guts, which weakens our immune system and allows more toxins to ultimately enter the body. Okay, so there's something this website you can go to. It's called keepantibioticsworking.com, just to find some information on there if you want. But we really want to try and raise awareness around this so that people are not buying food that's hammered with antibiotics. In terms of washing your hands, avoid antibacterial soap, you guys, because it also is contributing to resistance. Just use soap and water. Good soapy warm water will do the trick. So endotoxins, internal pollution from carbon dioxide and cell respiration, nitrogen from amino acid breakdown or catabolism, uric acid from purines or purine metabolism, bilirubin from hemoglobin catabolism, steroid hormones, free radicals that develop due to mitochondrial dysfunction and or pathological dysfunction, oxidized glucose, endotoxins in the form of intestinal sources, which become products of dysbiosis, basically, which is an out-of-balance digestive microflora, really, okay? And so you start to get these endotoxins created from these bacteria and yeasts and, the beta-glucuronidase, and all that sort of stuff, which ultimately can lead to short-chain fatty acid deficiencies, which ultimately affects the large bowel, okay? Those short-chain fatty acids are needed. Butyrate created by that is needed for large bowel health. So it becomes a domino effect that really starts to create a bunch of challenges. So health really begins in the digestive tract, okay? So the food that we eat must be digested properly, okay? Poor digestion is going to cause greater problems than not getting adequate macro or micronutrients to the cells that actually need them. If you're not getting good digestion, that's a bigger issue than not getting the nutrients, okay? So how healthy is your colon? One major line of defense is an effective barrier provided by an intact digestive tract, okay? If it becomes compromised, then higher amounts of harmful agents are going to be absorbed into the body. So there's paradoxical roles of our digestive tract. So the intestine selectively absorbs a wide variety of water-soluble and fat-soluble nutrients, and it's got to exclude undigested proteins, microorganisms, and the metabolic byproducts or toxins from the other things and eliminate them, okay? So the intestine is the largest immune organ. It's called the gut-associated lymphoid tissue or GALT system. Counts for about 40% of immune cells of your body, populated by T cells, macrophages, mast cells, B cells, et cetera, et cetera. So agents that begin to damage the GI mucosal integrity, bacterial enteric infection, alcohol, basically, food allergies, drugs and xenobiotics, toxic heavy metals, stress, poor quality diet, parasites, mycotoxins, viral infections. So what begins to happen as that occurs is you do something called leaky gut syndrome can start to kick in, okay? So signs and symptoms that are associated with chronically elevated intestinal permeability to foreign substances, that's what leaky gut syndrome becomes. It's hyperpermeability, which will lead to immune dysfunction, circulating immune complexes, liver overload, toxic accumulation, and ultimately oxidative stress within the body. Type 2 diabetic, Jane. If you're a type 2 diabetic, you guys know, I mean, it's really cool to see how people do on this. What's neat about this is that, and I get this a lot when people go back to their physicians and they're able to get off drugs and, their A1C, her A1C went down 2 points, which was gigantic for her, but they're blown away by it because they're not seeing it happen in the model that they work within. And these are very well-intentioned people, most of them. They just unfortunately work within a model that's focused primarily on just treating the check engine light and not figuring out why the check engine light came on. And that's unfortunately why they don't see the miracles that we get to witness in our offices. So in terms of the digestive tract, the gut breaks food into nutrients that the body can ultimately use. By the time that food reaches your small intestine, it's happening at a cellular or molecular level. Just a couple of real basic things on the small intestine. So when you think of your intestinal lining, the mucosal layer of a healthy gut filters out microorganisms and undigested proteins, which then get passed into large bowel. There's finger-like projections called villi. These protrusions in the mucosal layer are covered by a barrier made of a row of cells. Nutrients will enter the bloodstream through capillaries at the cells, at the base of these cells, okay, base of these villi. And so what can happen is, in terms of proper absorption, desmosomes, which bind these cells together, they're called tight junctions, will allow only small nutrient molecules to pass between them. So in other words, think about it as a secret handshake. You're only getting in if you know the secret handshake. If not, you're going to be eliminated through the bowel, okay? When this gets disturbed, when these tight junctions get broken down for a multitude of reasons, you can start to develop this leaky gut issue. And this irritation is going to weaken these tight junctions and open the gaps between the cells and let larger particles start to get in, okay, get into the bloodstream. And this starts to create some problems. So what are some of the causes of this increased gut permeability? It can be pancreatic insufficiency, creating poor digestion and ultimately malabsorption. Of course, drug therapies, radiation surgery, prolonged immobilization, so inactivity, excessive alcohol consumption. We know that alcohol, a lot of alcohol, ultimately is going to affect the GI mucosa, the mucosal lining. In chronic infections, viral and bacterial, stress, psychological, non-steroidal anti-inflammatories, a biggie. NSAIDs are a big, big issue. There's no drug that's safe, by the way, whether it's an over-the-counter or a pharmaceutical. About 25,000 people die every year from non-steroidal anti-inflammatories because of occult bleeding ulcers that they'll ultimately create. Now, they came up with this thing called Vioxx and Celebrex, 8, 10 years, I don't know, longer than that, but they're called COX-2 inhibitors. They came up with those to replace NSAIDs, and these COX-2 inhibitors, what Vioxx and Celebrex didn't do is they didn't deteriorate or cause the ulcerations within the gut lining. But the problem was that they caused a whole bunch of heart attacks and strokes and all sorts of other issues, which, by the way, they knew about even before they threw it on the market. And they made billions and billions of dollars before it got found out. But the point is that NSAIDs are not good, and I certainly, if it were me, I'd try to avoid Vioxx and Celebrex at every possible cost. So, and of course, antibiotics. The overutilization of antibiotics in this country right now is a major, major issue, and it certainly has affected people drastically in terms of their health because of what it does to the microflora, the microbiome of the gut itself. Okay, and remember, we talked about all those antibiotics that are injected into these conventional farms where they're hitting animals with them. So does stress increase gut permeability? Yes. Psychological stress may increase GI permeability, allowing luminal constituents access to the mucosal immune system. This provides a mechanism for the observation of stress-induced disease recurrence in Crohn's disease. NSAIDs induce gut permeability. Numerous studies show NSAIDs usage disrupt the intestinal barrier. Important consideration for patients with arthritic disorders who take NSAIDs. NSAIDs increase intestinal permeability. They may play a key factor in their disease process. So pretty powerful statement there. I'm going to mow through this stuff, but this is basically things to help you understand how a lot of challenges that people have are directly related to their gut and the dysfunction within the gut. So this just goes through, basically the thyroid for the most part. But one key thing that needs to happen is when the T4 comes out of the thyroid, it's the inactive form. It needs to be converted to T3, and that happens primarily in the liver and the digestive tract. And we're going to get to the liver here pretty soon. So when you have liver congestion, you've got digestive distress, ultimately can affect that conversion, which then starts to create an elevated TSH, which then creates a diagnosis of hypothyroidism, and then you're put on a synthetic thyroid drug, and that's, once again, not the reason why your TSH is elevated. So autoimmune disorders, once again, if you think about it from the standpoint of a leaky gut issue, when things start getting into the circulation of a person's body that are not supposed to be there, and they start circulating throughout the body, well, there's a system in your body called the immune system. Eventually, it's going to identify those things, and it's going to upregulate the immune system. And you're going to start, and some of these things will start to hide inside the cells of your body. And so the immune system will attack your cells' bodies to get to these toxins or these chemicals or these bacteria or viruses or whatever it is, which then creates this idea of an autoimmune condition, okay? So that's why it's so darn important to fix the gut. Adrenal stress and GI dysfunction, estrogen dominance and GI dysfunction. This goes to liver, by the way, too. You really want to, menopause and premenopause and all that sort of stuff. There's just a lot of unopposed estrogens that are not being conjugated within the liver because of the liver stress that's going on. Cardiovascular disease and GI distress. There's relationship there. Neurodegenerative patterns and GI dysfunction. Basically cognitive or brain function. Chronic fatigue. This is a biggie. When you start thinking about all these people that are consuming energy drinks like they're going out of style, they're just contributing to their problems by doing that. So that's a biggie. Autism. Autism is it's a really interesting thing right now that's going on. There's this guy, his name's Andrew Wakefield, and this is from him. He basically was ostracized by the medical community because he made the statement that it appears that the MMR vaccination may be contributing to autism or autism spectrum disorder, and that we should study it and look into it a little bit more. That statement right there essentially got him ostracized from the medical community. How dare you even question vaccination? So he's done a lot since then. He's a really amazing guy. But to go back to that, that's one that you want to think about. We're not at 1 in 50 children are autistic now, when in just a decade or a little over a decade ago we were at like 1 in 20,000, 1 in 10,000, whatever it is. Things don't happen that quickly without there being some sort of issue that's going on that we need to think about or look into a little bit more closely. Healthy liver function is the key. In addition to a healthy digestive function, the liver is the organ primarily responsible for modifying the toxins that come into your body or that come in through a leaky gut issue or whatever it may be, so that they can ultimately be eliminated from the body. It occurs in 2 steps, phase 1 and phase 2, where harmful fat-soluble chemicals are modified so that they can ultimately be removed or eliminated from the body safely. We won't go through that process. Concerns with histories of medications, prescriptions, and over-the-counters. This is from the New England Journal of Medicine. Adverse effects related to drugs are common in primary care. That's a low number, in my opinion. It says 25%. And the reason why we'll get to here in just a minute. But also from the New England Journal, acetaminophen, which is Tylenol, is the most frequent cause of liver failure. Low doses of acetaminophen, those only slightly above and even occasionally within the therapeutic range, were associated with severe hepatotoxicity. How many of you or of your family or coworkers or whatever are using Tylenol on a daily basis? One second. Let's see here. I got a chat from somebody. Yes, wheat. The gluten in wheat can contribute to gut permeability. Absolutely. And gluten actually, we're seeing that gluten affects those tight junctions. That may be another conversation that I have. So that was just a question that came in real quick. And I will answer questions at the end of this, by the way, you guys. So, but how many people that you know of are taking Tylenol regularly? How is it affecting their liver? What other issues is it creating that they aren't even thinking about? Okay. The incidence of serious and fatal ADRs, which is adverse drug reactions in the U.S. hospitals, was found to be extremely high. We estimated that in 1995, 94 overall, 2,216,000 hospitalized patients had serious ADRs, and 106,000 had fatal ADRs, and these reactions represent between the 4th and 6th leading cause of death. So this is from Death by Medicine, which was done. Ultimately, you can find it. If you Google Death by Medicine, you'll find this article, and I would suggest you read the whole thing. It's extremely educational, definitely. Okay, are hazardous chemicals and toxins stealing your health and vitality? Well, yeah, is the answer. So if you look at this, this is how it should work. As toxins enter the body, special nutrients are become available to activate specific enzymes that ultimately transform those toxins into benign substances that can be excreted, and as well as protect the body from damage that toxins may cause. So while other nutrients support the body's route of toxic elimination, this requires more nutrients be ingested so that then the cycle continues. Okay, and so when a body is functioning really well, this process is happening. Okay, and so the body is able to handle the toxins. So when you have people who come in and they're tired, many of them are actually they're toxic. Okay, they're just really toxic. So that's a lot of what chronic fatigue is. So it's already, it's been well established as we've moved through here that it's no secret that pollution and pollutants are a big problem. Its effects can be found, really just about everywhere. So what are the symptoms of a toxic body? Headaches, candida, gas, acne, fatigue, constipation, infertility, racing pulse, arthritis, constant hunger, dizziness, hyperactivity, allergies, bloating, body odor, general aches and pains, cancer, weakness, poor skin, PMS, sweaty palms, difficulty breathing, premature aging, obesity, irritability, depression, asthma, bad breath, insomnia, sinus congestion, varicose veins, difficulty concentrating, or what we call brain fog frequently. So those are just some of the many symptoms right there. So toxins will accumulate over time, like we talked about. It's a progression of time. Okay, so the literature tells us that the toxins accumulate in our body over time and are difficult to dislodge. So the body has a difficult time as they accumulate and as the body becomes overwhelmed in terms of getting rid of them. So the process of removing these poisons is called detoxification. We call it biotransformation or biodetoxification. How toxic are you? I don't know. These are common questions that we can ask to start to get some answers to that. Okay. So we ask those. Real quick on heavy metals, I wanted to come back to that because of that story with William. Just remember, heavy metals you want to be really conscious of, and why? Well, lead over time can be especially damaging on the kidneys and associated with or can cause high blood pressure. Metals affect the thyroid and other organs vital for healthy metabolism. Mercury is well known for its toxicity, contributing to nerve damage. Can also be a causative factor in Alzheimer's, and adding lead to the picture and more neurological involvement, chemical toxicity, arthritis, and organ dysfunction can occur. Okay, so biodetoxification, also known as detoxification or biotransformation, chemical changes for xenobiotics are endogenous compounds that render it less toxic and more readily excreted. So the body can get rid of these things. Many environmental chemicals, xenobiotics, are fat soluble and they're readily absorbed, but difficult to excrete. Okay, and being fat soluble, that's why they'll get lodged in the adipose tissue or in the fat tissue. Okay, so to increase excretion, the body attempts to convert the lipophilic chemicals to more water soluble forms, and that's how it ultimately gets detoxified. Okay. Sites of biodetoxification. Well, basically what we've talked a lot about here is first pass metabolism. 25% of it is in the GI tract activity. Liver is a major contributor. Secondary, liver is primary site, and then you get the kidney, skin, and lungs involved in the process. Okay, but the digestive tract and liver are big, really, really important. So what are causes of impaired biodetoxification? Obviously overwhelming toxic load. Impaired excretion, so constipation or decreased transit time, renal dysfunction, which is the kidney challenges, inefficient fuels. So in other words, macronutrient imbalances, and a lot of people are walking around with this issue, as well as mineral imbalances and mineral deficiencies. So deficiency of detoxifying substances and dysregulation of detoxifying enzymes. So excessive intake of certain nutrients, I don't know that I would call them nutrients, but excessive sugar is going to inhibit detoxification. High glucose intake is going to increase the uptake of our carcinogens. Excessive sodium, white table salt, which you want to avoid, by the way, limits detoxification. High consumption of partially hydrogenated fats can affect cell function, which affects metabolic function, affects detoxification. High saturated fat diet can alter cytochrome P450. Which cytochrome P450 are basically it's an enzyme to metabolize potentially toxic chemicals, like drugs as an example, okay, or products that would be produced by endogenous metabolism. So that's why avoiding high amounts of saturated fat products. Saturated fats are not bad; it's just a high amount of them can become problematic. Dysbiosis, overgrowth of pathogenic microorganisms, increased production of beta-glucuronidase, short-chain fatty acid deficiency we talked about. Impaired detoxification is going to come from malabsorption, so the deficiency of amylase, pancreatic enzymes, and HCl. Hyperabsorption, which is going to come from the leaky gut issues or the broken digestive tract, so you want to fix that leaky gut. Hypochlorhydria, this is too little acid, by the way. And a lot of times when people have too little acid, they actually get reflux. They get gastroesophageal reflux disease, okay? So 99+% of the time we can resolve reflux by giving a person HCl. The issue is that conventional approaches are treating reflux by creating more hypochlorhydria. They're using proton pump inhibitors, which are turning off the acid pumps. And by the way, those proton pump inhibitors are being shown to be associated with chronic kidney disease too, by the way. But how you fix hypochlorhydria or how you fix reflux is you typically increase HCl production. So you support the gut with HCl, which is vitally, vitally important based on this next statement that key minerals and nutrients need HCl for breakdown and absorption, okay? So what would be reasons for cleansing? Well, prevent disease, reduce symptoms, help heal disease, cleanse the body, repair organs, purification, rejuvenation, weight loss, clear skin, slow aging, improve flexibility, improve fertility, enhance the senses. It's going to definitely aid in becoming more organized because you're going to get clarity, more creative, more motivated, productive, relaxed, energetic, clear, conscious, more spiritual and inwardly attuned, environmentally attuned, relationship focused. It sounds corny, but it's crazy how when the body starts working, how good you can feel and what it does. So ultimately, detoxification is about cleansing and recharging, your mind, body, and your soul. And that's really what this is about. So optimal health and energy requires that each and every cell of our body, and by the way, anywhere from 27 to 55 trillion cells, so you want to keep them functioning at a high level, but you want to make sure that each and every one of those cells is vibrantly clean and well nourished. And if that's accomplished, it's very, very interesting how a person's host of ailments start to just disappear, miraculously. Well, there's no miracle to it, you guys. That's how our bodies were designed to function. And when the body is functioning the way it's designed to work, it's crazy how well we do. So in terms of detoxifying, there's 2 simple detoxification plans that basically I put together. There's so many different things that you can do, but these were geared towards really the 7-day advanced body and intestinal cleanse. This is really about this process of healing the gut and doing things to start getting the gook and the gunk and all that stuff out of the large bowel and the small bowel, and then start to pull things from the tissues of the body, okay? So it was really designed with the working person in mind, to be honest with you, okay? So in terms of the 7-day, it's exactly that. You're going to do 7 days. You're going to get all the necessary supplements that you would need to support that detoxification process. We definitely want to do a pre-detoxification body composition analysis so that we can look at that afterward. You're going to get a food plan from us based on how to eat during that detoxification period. And the food plan is really based on minimizing stress on the digestive tract. It's an easy way to eat. You're just not going to be eating a lot of proteins and foods that are hard on that. We want to soften the process for the digestive tract as we cleanse it and we promote its healing. There's an enema bucket that's going to be provided to you because I want to promote something called a coffee enema on this. And people, if you've never done an enema or a coffee enema, then you don't realize the amazing benefit that it has. And it really, honestly, is pretty easy. But it's going to, and we'll give you directions on how to do that. You can do it. You can do it every day throughout the program, or you can do it a couple of times. Or you don't have to do it if you don't want. You'll still get results. But I want to. I'm all about the best result possible. And I want to educate you about what's available to you and what's possible for you. So we'll give you instructions on the coffee enema and how you do that. We're going to do, once you complete the 7-day, we'll reevaluate sort of where you're at, and we can do a liver colon detox support food scan after that. In other words, what are the best foods for you to eat to support that continued functionality, if you will, and support of these key areas, these key organ systems, the liver and the colon, or the liver and the bowel, okay? Of course, liaison and coach support along the way too. The investment for the 7-day program is $394.12. There's another one which is a really basic and simple one. It's just a liver gallbladder cleanse. Same thing. We'll provide you with the supplementation that you need for the liver gallbladder cleanse. We'll do a pre-detox BCA. We'll also do the liver colon detox support food scan so that you know kind of the best foods for you to eat during that period. Liaison coach support. The investment for that simple one is $114.80. So these are not expensive, crazy off-the-chart detox plans. What these are plans that help to get you back on track. Think about it like rebooting the computer. And honestly, what I would oftentimes recommend to people, especially if you really want to be serious about this, is you do the 7-day, you get through that, and then you convert into doing the liver gallbladder, because the liver gallbladder is really, it's something that you're going to do. And you'll see, we have you do something basically once a week, really over a 2-month period, okay? Real supportively to help improve liver and gallbladder function. But you're going to really increase the benefit of that if you do the 7-day, okay? But once again, it's really dependent upon what it is that you want to accomplish, okay? So what do? You can call the office or your coach to schedule to come in and go over that. You can email your liaison tonight if you want and tell her you're ready to get cleaned up. She'll email you a biodetoxification questionnaire, and then a coach will call you to go over the questionnaire so that the both of you can decide what makes the most sense for you based on your current situation or your health goals, okay? Because it really is about what is the result that you want to achieve. What is it that's important to you, And when we know that, then obviously we're all on the same page and we can achieve that goal or that objective. And then simply set the date to start your detox. It's pretty simple, all right? So we're just barely over an hour. I'm sorry, I tried to move as fast as I can through things. So I want to go ahead and open it up to questions. If you have questions, like I said, I will stay as long as necessary to answer those questions. So what's going to happen is I'm going to open. You're going to see something pop up. It's a Q&A session, and you just get into the queue, and I'll take your question. So it'll unmute you, and you can ask your question. So I'll open that up right now. So go ahead, and if you have a question, just hit the Q button or whatever, or the question button, and I'll happily answer the question for you. So anything on the detoxification, that we went over, what happens to the body as it becomes overwhelmed, any of that stuff, okay? Hold on, there's a chat question here. Okay, so there's a question here. It says, is pink salt not sodium? No, it's not. So the pink salt that you get from our office, it's actually, think of it as a mineral supplement. That pink salt is loaded with 93 plus trace minerals. There's multiple minerals within that pink salt. And what gives it the pink hue is actually the volcanic ash. That particular salt is it's a combination, 50% Mediterranean, 50% Hawaiian, okay? And so the volcanic ash that comes from the Hawaiian salt gives it the pink hue. But sodium is it's one particular nutrient, if you will, okay? And that's basically what white table salt is. It's sodium. And that's why you want to avoid it, because it creates extreme imbalances within the body. It's like white sugar. White sugar is, they've just basically ripped everything from cane sugar. So if you were to consume sugar, cane sugar would be the better choice as opposed to white sugar, okay? So if you're utilizing the pink salt, which I recommend to everybody, you're more or less taking a mineral supplement, okay? Because if you use a lot of sodium creates an imbalance. It's hydrophilic. It'll attract water, and that's where you can start to see people that start to have all these imbalances over time get blood pressure issues or blood pressure challenges, okay? So hopefully that makes sense. Let's see here. How did the detox plans work with the Nutrimos program in phase 2 now? You want to wait till I tell people to wait until you complete phase 4. Phase 4 is the reset phase, and I'm actually when you're doing the 7-day cleanse, I'm going to have you eat more complex carbs, so some starches a little bit, because they're easier on the digestive tract and they're going to support the process of gut healing. Okay, so when you complete phase 4, you could go ahead and do the 7-day cleanse as an example, and then when you complete that, that's another thing. If someone wants to lose weight, it's when you get your gut operating on a high level and you start to fix this, if you decide to move into more weight loss, it's going to support that process substantially, okay? So let's say you're a person that's thinking you want to lose another 30 pounds, and you want to do another round of the Nutrimos program as an example. Well, I might suggest to you, if you've never done a cleanse or you've never done any sort of detoxification or anything to address digestive stressors like what we're doing with the 7-day, I may say, hey, you know what, do that, and then we'll get you rolling on the weight loss, and you'll probably have that much more of a positive benefit even. I mean, either way, you're going to get a great result, but you begin to think about what's the end result that you want, how often do you recommend doing the cleanse? Is this a good maintenance program? Yeah, absolutely. So I recommend a good cleanse at least twice a year, once to twice a year. There's another program that I have. It's a 21-day program, and I wasn't even going to come close to that. Was one that I did a lot in the past with really, really sick people, people that had fibromyalgia issues and all that sort of stuff. I've taken this 7-day really is going to be very powerful for people. I mean, what's great about it is that we've taken a lot of really good things and built it into a week-long period to get people momentum, to really get them cranking. So it certainly is a good maintenance program. Once again, part of that program is to teach you about enemas and coffee. So we're going to teach you the coffee enema, and there's a lot of benefits to coffee enemas, by the way, which is not only going to help to clean out the large bowel, which is really, really important. And even if you're a person, by the way, that has regular bowel movements, you're going to be blown away at what comes out, like what your body gets rid of when you do this. And it also is going to help to improve liver function too, by the way. It's going to really support the liver on a deep level also, okay? So any other questions on that? You can chat in your question, or if you just hit your Q&A button, it'll bring you into the queue, and you can ask your question if you want as well. So anything. Okay. Well, I want to say thank you for joining. I know it's a Thursday, and obviously people have busy lives, but my intention moving forward is to do more of this so that we can hopefully continue to educate and give you tools, strategies, ideas, things that can help you achieve the health that you want to achieve. And it really is up to you on how you can be as healthy as you decide to be. I'm telling you. And I think you guys, what I want to shift perspective for people is to think of your health as an asset. It truly is our greatest asset. And if we don't take care of it, eventually we're going to wish we did. And unfortunately, it costs us a heck of a lot more money. It costs us a lot more in terms of quality of life than had we invested in it earlier. So don't forget that. Invest in your health. I'm telling you, it'll pay you back tremendously. Let's see, Jamie, a couple questions. How can people listen to the recording? We'll get you guys the link to this. I was thinking of doing this again on Monday, by the way, because there were a lot of people that emailed in that said they couldn't make it. But we'll post the recording so that you can get the recording to people if you'd like. So if you have friends, yeah. So absolutely. So we'll make sure you get access to the recording. Okay. You're very welcome. Greg, you were popping up in the queue. Do you have a question you want to ask? I want to make sure that that your question gets asked if you have one. Okay. Okay, everybody. Well, hey, if this was helpful, would you? I don't know. Sometimes it's hard to get people to come to these things because they just think it's going to be a bunch of fluff, and that's the last thing that I want to do is deliver fluff. I want to bring you content once again that I hope you find to be, beneficial, empowering, educational, whatever it is. Because the healthier you become, the healthier your circle of influence will ultimately become, because they're going to start to look at you as an example and as a leader. And your family is going to start to become healthier. And that's how we start to gain momentum and we work to create change, together. And that's really what this is all about. So, so tell other people, or if we earn it, if you, go to our Google review page and give us a Google review and tell to say that these things are helpful or whatever. If they're not, let me know, please, because I want to make it better, definitely. But at any rate, I hope it was helpful to you guys. I appreciate all of you. I'll give you another 30 seconds, 15 to 30 seconds. If there's no other questions, I'll hang up. So please ask your questions if you have any. If not, have a great night, everybody, and we definitely appreciate you.